I'm Bill McDonald, and I'm an anesthesiologist at Providence Health Care, and my area of practice is in pain management. Pain can be acute, straightforward, and short-lived. For instance, if you break your arm or have an operation. However, when pain becomes chronic, it becomes very complex. And by complex, I mean it becomes not just a biological problem, but it's a biopsychosocial problem. It affects all areas of the patient's life and their family's life as well. Chronic pain is very hard on families. So it affects things like mood, depression and anxiety. It affects relationships, both in the family, workplace, feelings of self-worth. The list just goes on and on. And these are the kind of patients that we treat in our chronic pain program here.
A lot of these patients have, and individuals and families have lost hope that they can live a life free of pain, and that Dr. McDonald is able to renew that sense of hope that you can be free of pain and continue to live a life of, whether it's going back to work or just maintaining your social relationships and having a quality of life that is meaningful.
Okay there, Trevor?
My main area of interest is in neuromodulation, and what that is treating the very severe forms of chronic pain with implantable devices that either deliver electricity or medication to the spinal cord and interrupt pain transmission that way. Some of the time we do procedures for patients who have terminal illness, and we're trying to predict what sort of treatment might work for them and provide them comfort in their last days.
Okay, we're done.
Louise and I would probably both agree that we do describe Dr. McDonald as being a leader and a visionary, a pioneer of pain management, someone who goes above and beyond what would be the normal call of duty to ensure quality of life and pain control in a patient population, which includes chronic pain and often pain due to a life-limiting diagnosis.
He is a pioneer and he's a fighter for patients. He absolutely is a fighter for patients, and his bottom line is patients' well-being.
If you want to ask a question as we go along.
So with all these different aspects to the patient's complex pain, the important thing is that we treat all of them if we're going to be successful. And we work as a team in order to do that. We have specialists in various areas that are expert at dealing with those individual areas, and we work together as a team. We also believe that the most important person on that team is the patient. So patient-centered care is a key in our program. We want the patients to be not just recipients of care, but actually participants in their own care. And that's not just the patient, but it's also the family. And we try to address the patient as a unique individual. And we do that through compassionate care, and we do that through teaching and research so that others can continue on in that fashion.
Dr. McDonald's treatment changed my life enormously. You know, by the time I met him, I'd been through more than a year of hell, and he treated me like a human being, like more than that, like a person who had a real issue that really needed to be dealt with. I went back to school, I got a graduate degree, I started working full-time, and all of those things seemed so far out of my reach before I'd experienced I had the pump implanted and been treated at the pain clinic. And all the while through that treatment, Dr. Mack was, he was there every time. He was willing to entertain any idea I had. He made it so clear that I was the captain of this ship, and was there for whatever conversation we needed to have.
I was deeply honored and very surprised when I heard about this award, but the two individuals have helped me so much over the years. Their support and patience and their basic good nature has really inspired me to keep doing what I do.